What if I told you that the answer to how long you're going to live, and even how you're most likely to die, has been quietly sitting inside your body since the moment you were born? Not in your diet, not in your exercise routine, not in your family history, at least not in the way you think, but in something far more fundamental, something microscopic, something that billions of people walk around with every single day and never think twice about. I'm talking about your blood type. And today, I'm going to show you the science behind why your blood type is one of the most powerful and most ignored predictors of your health, your disease risk, and yes, your longevity. Stay with me because what I'm about to share might genuinely change the way you think about your body forever. I'm Dr. Richard Ben, and welcome back to the channel. If you're new here, this is the place where we cut through the noise, ignore the fads, and go straight to the science. And today's topic is one that I have been wanting to cover for a long time because it sits at this fascinating intersection of genetics, immunology, cardiovascular medicine, and longevity research. It's controversial in some circles, it's misunderstood in others, but the data is real, the studies are peer-reviewed, and the implications are enormous. So let's start with the basics, because I want to make sure everyone is on the same page before we go deep. Your blood type, whether you're type A, type B, type AB, or type O, is determined by a set of antigens on the surface of your red blood cells. These are tiny molecular markers, proteins and sugars, that your immune system uses to identify what belongs in your body and what doesn't. You inherited your blood type from your parents, just like you inherited the color of your eyes or the shape of your nose. You cannot change it. You cannot train it. You were born with it and you will die with it. And that last part, how you die, is exactly what the research is starting to reveal. Now, before I go any further, I want to be very clear about something, because I know this topic can raise some anxiety. This is not a death sentence. Knowing your blood type's risk profile is one of the most empowering things you can do, because knowledge is the foundation of prevention. When you understand your vulnerabilities, you can take targeted, intelligent action to protect yourself. That's the whole point of what we do here. So let's dig in. Let's start with type O because type O is often held up as the golden blood type, and in some ways that reputation is earned. People with type O blood have consistently shown lower risks of cardiovascular disease in large-scale studies. A landmark analysis published in the journal Arteriosclerosis, Thrombosis, and Vascular Biology found that individuals with non-O blood types, meaning A, B, and AB, had a significantly higher risk of coronary heart disease and heart attack compared to type O individuals. Why? Part of the answer comes down to a protein called von Willebrand factor. This is a clotting protein in the blood, and people with type A, B, and AB blood have naturally higher levels of it. Higher von Willebrand factor means a greater tendency for blood clots to form. And blood clots, as you probably know, are the direct cause of most heart attacks and strokes. Type O individuals tend to have lower levels of this protein, which gives them a natural protective edge against clot-related cardiac events. But here's where it gets interesting, and where type O loses a little of its shine. Because while type O blood provides protection from heart disease, it comes with its own set of vulnerabilities that most people never hear about. Type O individuals have a significantly higher risk of peptic ulcers. Why? Because the bacteria Helicobacter pylori, the primary cause of stomach ulcers, has a particular affinity for the blood type O antigen. The bacteria essentially uses that antigen as a docking station. Type O people are also more susceptible to certain types of infectious diseases, including cholera and some forms of norovirus, for very similar reasons. So yes, your heart may be safer, but your gut and your vulnerability to certain infections are a different story entirely. Now let's talk about type A, because type A carries a burden that the research has been building a case around for several decades now. And if you are type A, I need you to really pay attention here. Not to panic, but to understand what your body is up against, so that you can fight back intelligently. Multiple large studies, including a massive meta-analysis involving hundreds of thousands of patients, have found that type A individuals have a meaningfully higher risk of developing certain cancers. Gastric cancer, stomach cancer, shows one of the strongest associations with type A blood of any cancer blood type pairing in the literature. The reasons are still being worked out, but one leading hypothesis involves the way type A antigens interact with the immune system's ability to recognize and attack abnormal cells. There's also research suggesting that the gut microbiome composition differs by blood type, and that type A individuals may harbor microbial patterns that create a more inflammatory intestinal environment over time. But it doesn't stop there. Type A individuals also face elevated risks of venous thromboembolism, that's deep vein thrombosis and pulmonary embolism, dangerous blood clots in the legs and lungs. Again, that von Willebrand factor comes into play, but there are also differences in factor VIII, another clotting protein, that compound this risk. And there's something else that doesn't get nearly enough attention in mainstream health discussions: the relationship between blood type and stress physiology. Research has shown that type A individuals tend to have higher baseline levels of cortisol, your primary stress hormone, and mount a larger cortisol response to stressors than type O individuals. Over time, chronically elevated cortisol is devastating to almost every system in the body. It accelerates cellular aging, it suppresses immune function, it drives inflammation, it promotes abdominal fat storage, it raises blood pressure. For type A people, the management of psychological and physiological stress isn't just good advice, it is a biological imperative. Now, let's shift to type B. Type B is in many ways the least studied of the 4 blood types, partly because it's less common in many of the populations that have been the subject of major Western medical research. But what the data does show is quite significant. Type B individuals appear to have an elevated risk of certain autoimmune conditions. There are associations with lupus and other inflammatory conditions that are more pronounced in type B populations. There are also findings linking type B blood to a higher risk of ovarian cancer in women. And perhaps most interestingly, some research has pointed to cognitive decline and Alzheimer's disease risk. A study published in the journal Neurology found that people with type AB blood had the highest risk of cognitive impairment, and type B was positioned closer to the higher risk end of the spectrum than type O or A in certain analyses. We'll come back to AB in a moment because that is a fascinating and somewhat alarming story on its own. But before I get there, I want to spend a moment talking about something that ties all of this together, and that's inflammation. Because if there is one thread that runs through all of these blood type risk associations, heart disease, cancer, clotting, cognitive decline, autoimmune disease, it is inflammation. Chronic, low-grade systemic inflammation is the underlying driver of virtually every major killer in the modern world. And your blood type influences your baseline inflammatory state in ways that are only beginning to be fully understood. The antigens on your red blood cells interact with your immune system, with your gut bacteria, with your hormonal environment, and with the way your blood vessels respond to injury. All of these pathways feed into your inflammatory status. Understanding your blood type is, in part, understanding your default inflammatory fingerprint. Now let's talk about type AB, because type AB deserves special attention. AB is the rarest blood type, found in only about 4% of the population. It's the most recently evolved of the 4 types from an anthropological standpoint, and the research paints a complicated picture. On one hand, type AB has some of the cardiovascular vulnerabilities of both type A and type B, including elevated von Willebrand factor and clotting risk. On the other hand, type AB has some unique immune characteristics that can be protective in certain contexts. But the finding that has generated the most discussion in recent years is the link between type AB and cognitive decline. That neurology study I mentioned found that people with AB blood were 82% more likely to develop thinking and memory problems, the kind that often precede full-blown dementia, than people with other blood types. The proposed mechanism involves factor VIII and its effects on small blood vessels in the brain, as well as differences in how AB-type individuals process certain neurological proteins. For AB individuals, brain health and vascular health become intimately linked concerns that deserve proactive, targeted attention from as early an age as possible. So at this point you might be wondering, okay, Dr. Richard Ben, this is a lot to take in. What do I actually do with this information? And this is where I want to spend the final section of our time today, because the research on blood type risk is not a passive death forecast. It is an active roadmap for personalized prevention. The whole science of precision medicine, medicine that is tailored to your individual biology, depends on understanding exactly these kinds of genetic and molecular risk factors. Your blood type is one of the most accessible pieces of that puzzle. If you are type O, your cardiovascular protection is real, but don't let it make you complacent. Your ulcer risk means you should be vigilant about symptoms like persistent stomach pain, acid reflux, and dark stools. If you haven't been tested for H. pylori, talk to your doctor about it. Your slightly higher susceptibility to certain infectious diseases means that immune support, adequate sleep, vitamin D optimization, stress management should be a consistent priority. And just because heart disease is less likely doesn't mean it's impossible. Lifestyle factors can always override genetic advantages. If you are type A, your most powerful tools are anti-inflammatory lifestyle choices and stress management. And I mean rigorous, intentional, daily stress management, not just the occasional yoga class or weekend off. I'm talking about building a genuine practice around cortisol regulation. That means quality sleep as a non-negotiable priority, because sleep is the most powerful cortisol reset mechanism we have. It means regular, moderate-intensity exercise, not excessive, grinding exercise that itself becomes a cortisol stressor, but consistent, enjoyable movement that keeps your inflammatory markers low. It means a diet rich in anti-inflammatory foods, colorful vegetables, omega-3 fatty acids, fermented foods for gut health, and it means regular cancer screenings, particularly for gastric cancer if you have a family history or live in a high-incidence region. Awareness is everything. If you are type B, the autoimmune angle means that protecting your gut health is especially important for you. The gut is the control center of immune regulation, and a disrupted gut microbiome is one of the primary triggers of autoimmune flares. Prioritize dietary diversity, minimize ultra-processed foods, consider regular probiotic support, and stay on top of inflammatory markers in your routine blood work, things like C-reactive protein, ESR, and homocysteine. If cognitive health is a concern, and given some of the data it should be on your radar, early investment in cardiovascular health pays dividends in brain health because what's good for your blood vessels is good for your neurons. And if you are type AB, I want you to become absolutely obsessive about two things: your blood pressure and your cognitive health. These are your two most vulnerable systems based on the current evidence. Keep your blood pressure in the optimal range, not just normal, but genuinely optimal, because chronic, even slightly elevated blood pressure is like sandpaper on your blood vessel walls, and over decades, that damage accumulates straight to the heart and the brain. Brain protective habits, regular mental challenge, social engagement, quality sleep, omega-3s, aerobic exercise, and blood sugar regulation should be woven into the fabric of your daily life, not treated as optional extras. Now here's the big picture I want to leave you with. Longevity is not just about living longer. It's about living well, staying sharp, staying strong, staying independent and vital into your 70s, 80s, and beyond. The research on blood type gives us one powerful lens through which to understand our individual vulnerabilities. But it works in concert with everything else we know about health: sleep, nutrition, movement, stress, relationships, purpose. No single factor, not even something as fundamental as your blood type, operates in isolation. The body is a system, and optimizing any one variable while ignoring the others will always leave gains on the table. What the blood type research ultimately confirms is something that the best doctors and scientists have always known: we are not all the same. Cookie-cutter health advice will always fall short for a significant portion of the population because our biology is genuinely, meaningfully different at the molecular level. The more we understand those differences, the more targeted and effective our approach to health can become. So here's your homework. Find out your blood type if you don't already know it. Your doctor can tell you, or you can get a simple home test. Write it down. Sit with the information I've shared today and think about which of those risk profiles applies to you. And then ask yourself honestly, are you already taking the steps that your specific biology calls for? Or are there gaps? Because that's where the real work happens, not in the knowing, in the doing. I'm Dr. Richard Ben. Thank you for spending this time with me today. If this video helped you see your health in a new way, please share it with someone who needs to hear it. Drop your blood type in the comments. I'd love to see the breakdown of this community and answer your questions. And if you haven't subscribed yet, now is the time, because we go this deep every single week. Your health is not an accident. It is a decision you make every single day. Let's make it together.